with stomach pain. So I really thought I had just the flu, or stomach virus. And it just got to the point where I couldn't take it anymore. So I went to the ER and they did a CAT scan and told me, and then I was admitted. I mean, I didn't go there expecting to be admitted. I thought, like I said, I just had a stomach virus.
Okay, and then what happened?
And then they, after the CAT scan, they admitted me and told me that I had stage 4 cancer of the colon.
Twisted
Oh yes,
bowel.
I'm sorry. Twisted intestines.
Was a big old.
And twisted intestines, and they cut out the area of the intestine, and he went like that, so I imagine it was that long, and took that out, and he took 2 masses out. I don't know why it wasn't why they weren't able to take all of it out, but.
Okay, yeah,
So you have pictures?
Yeah, I was actually thinking to show you something, but I just realized I don't think we'll have your scan. Okay, so then you stayed in the hospital for a little bit?
Yes. I was in there for 4 days, 5 days.
Okay, and how do you feel now?
I've never felt better.
Okay, so now you're feeling good.
Yeah, I mean, like I said, I've always felt fine. I've never had any symptoms whatsoever. None.
No bleeding, no change in bowel habit,
No, nothing.
like constipation or diarrhea, or like bloating or weight loss.
Nothing.
It's just having.
No, and like I said, that's why I thought, I must have a stomach virus.
Yeah. So from what I saw, unfortunately I don't have the actual film, but I do have the report from the scan. So from what I saw, it sounded like what the surgeon did, which, as you said, like he removed the area in the colon that had the cancer,
right.
Had the cancer in, and he usually when you do that, you also remove some of the lymph glands that nearby.
Yeah, he said there was
2.
Yeah, 2. He took out 19 lymph nodes.
And 2 of them was
2 were bad.
Positive. So he removed some of the lymph glands, and 2 of them were positive, which is important. But also, it seems from what he said in the notes that there was like a spot, not in the lymph node, just like kind of like nearby in something called peritoneum, which is a lining of the abdomen. There was a spot there that he was concerned about, and then he removed it or took a biopsy, and this came back that cancerous spot. So
and see, that's what I guess it really and truly was not really explained much to me, other than, you had 2 masses, we removed them, we removed part of the large intestine, but nothing was explained to me of, like why they couldn't get it all, or that it could be treated to get rid of it, and didn't mention the abdomen. So I guess I feel like, I left there not knowing a whole lot more than I did when I went there.
Sure. No, I understand. Sometimes also it's overwhelming. Just like especially if you were healthy before and you were feeling fine, and just have like a lot of news. But what I was going to say, so he removed, the surgeon removed the cancer from the colon, which obviously showed cancer, but 2 of the lymph nodes had cancer too in it. And then that other piece, that the peritoneum that he removed, that had cancer, that's very important information, because that just indicates the cancer did travel from the colon, where it starts the colon, to that area outside of the colon. Technically, that will qualify by the book as a stage 4 cancer.
So if this is your colon and it went from, say, here and crossed over to the abdomen, like, couldn't that have been removed at the time, or?
So I think that's what he did. He removed that external area, like the faraway area outside of the colon.
But see, he told me that was, I didn't get it all that was removed, because he said, it's bad because they're so far away from each other. So that led me to believe that he didn't remove it.
What is not far away from each other?
From the kidney,
Huh?
I'm sorry, from the colon to the stomach, where it was attached to the stomach.
Okay.
He didn't. He said this is why I'm worried, is because there's such a distance in between the
I
two.
think he means that it metastasized.
Well, I didn't
Is that it?
understand.
Yeah, I'm not sure if I fully understand your question, but I think is an issue, at least from what I understood from his note, that here is a colon, and then there is a far away area that
Right.
had a cancer spot. So I think that's what he was saying. That it traveled. I don't know if is that you trying to say, or
Yeah, basically, if it sounded like, okay, I removed here from the colon,
yeah.
got rid of that, but he didn't say he got rid of this one over here.
He had excision biopsy or just like biopsy?
Excision.
Excision biopsy. So from his note saying that he removed it all,
Okay.
at least that's what he said. But just me back a little bit, because I want to make sure I make that point. So the cancer starts in the colon
Mm-hmm.
and then travel or metastasize to that area.
Mm-hmm.
Because of that fact, that make it stage 4 cancer. So in theory, nothing is impossible, but in theory, most of the time, we cannot get rid of those cancer, right? So usually we give treatment to suppress it and delay the progression, like prevent or delay or just slow any cancerous spots that there to be like to grow or the cancer to spread. And traditionally, it depends on a few things, but traditionally we use chemotherapy to do that.
What kind of chemotherapy? Because there's several types, right?
Yeah, there are a few Asian, but I'm happy to talk to you about the names, but I want to make like just the important point first. So traditionally we use chemotherapy to kind of control the cancer. Now, there is a difference between stage 4 and stage 4. So sometimes, although by the book, if the cancer is spread to any area outside of the colon, like in the liver or lung or like the peritoneum or lining of the abdomen, thing like that, that make it like stage 4. But also you have those patients who have like spots everywhere, like 10, 20, 50 spots in the liver, 10, 20, 50 spots in the lung. That's kind of like different stage 4. Like by the book definition, just because it traveled, all of them get called like stage 4. But like we know, like it's not really the same. So when we have like a lot of cancer spots in the body, it becomes really hard to get rid of them. It's just, like because it's just like even if you remove one, another one gonna appear, or if you remove couple more appear. Sometimes if we have one spot or 2 spots outside of the colon, even though we know they are still stage 4 technically, but we say, okay, maybe can we remove everything? So, and the hope that maybe if we remove everything, it doesn't come back. Usually, to be honest with you, like most of the time it does come back, but every now and then it doesn't, which is great. So, the first thing actually I need to know, I need to talk to the surgeon, because even from the note, like I have like a feeling of what he did, but I need to talk to the surgeon to really have a better understanding of what did he do, like how much surgery he did,
Right.
and like few other questions, like one, did he see other spot in your abdomen aside from the spot he was talking about, and two, like was he able to remove everything, all the cancer spots out, or still some left behind? Based on that answer, I think the plan might little be different. But I would say, like the immediate step, I think, still should be chemotherapy.
Yeah.
The chemotherapy he recommended, the FOLFOX, I think is very appropriate. That's actually the right treatment. So I would do that. If he say there were like too many cancer spots and were a lot of them there and all that stuff, I think the plan will be like a lifelong treatment, like diabetes or high blood pressure or something you just need to have treatment for. But if, which may be the case, if he said no, there were not too many cancer spots, and I was able to remove everything, at least I saw, I think it will be reasonable to do the chemotherapy for a little bit. It's like more like a judgment call, like 3 months or 6 months of chemotherapy. Then perhaps have one of the surgeons, either him or a colorectal surgeon, just go in back, like in your abdomen with a scope, just take a look at things and see if any cancer spot there, and if he can remove it. We call it cytoreduction, but very much like the surgeon goes in and just clear everything. That's like in the peritoneum. That's assuming there are no like liver spots, no lung spots, stuff like that. So no other.
And I guess that's what I was questioning. You know, if you saw something left there, why wasn't it taken out while you were there?
I don't know.
Yeah. And, you know, not to get off of me, but he had cancer a while back, and they treated it with some sort of beads.
That's prostate cancer.
Radioactive beads,
That's
And
prostate cancer.
gone.
Yeah.
liver cancer.
Yeah. So yeah, colon cancer, we usually don't do radiation like for it, for a lot of reasons. But as I said, like I think surgery will, in my opinion, just reading what happened because of the pain and the like thing, the intussusception he had, I think it's reasonable to do it. Obviously, I don't know the answer for why he did or didn't do things, so that's a question to him. And as I said, I'm happy to talk to him too. But I would say the immediate step to do the chemotherapy that your doctor recommended is the right one. I think it's appropriate. Actually, that's standard of care. But the extra step will be like trying to find out if are any cancer spot still there in your body or not.
Right.
If there are and they are limited to a certain area in this like lining of the abdomen, I think it's reasonable to go after them at some point.
Yeah, and he didn't say there was any others. He just said, excuse me, that you know, he cut that out, put them back together again, and you know, he mentioned that it was really bad, and I guess that's what really bothered me. It was really bad. It's really bad because they're so far away from each other. And my thought, if you've seen that, why wasn't it taken care of while you were there?
Did you ask him that question?
No, I did. You know, the first time you hear stage 4, you know, you pretty much don't hear anything else.
Sure.
So
Are you gonna see him again?
I
Like you have a
really
full-
wanna
yeah.
come here.
No, but you have a follow-up appointment with him?
No, cause I made it here, and like I said, that's a smaller hospital, and I'd rather come to
Okay.
someone who
So
specializes.
one thing I can do, I actually, if you like, I can ask one of our colorectal surgeon to see you too and give us an opinion, which would be helpful.
Yeah.
Yeah.
I mean, like I said, they're all very nice there, but, I mean, this is a cancer institute. And.
But I just also I have to be like very candid. The treatment, I don't know your doctor, like the oncologist, the cancer doctor there. I don't know what I don't know him, but what he recommended is appropriate.
Right.
Like I would just what I would do too. Yeah. So it's really up to you. I mean, I think it's a good idea to see one of our surgeons. I
Yeah.
agree with that.
I would like that.
But in terms of the chemo, because you need chemo, whether it's gonna be for short term, like 6 months, or long term, like longer term, I think that will be determined like a little bit in some of the answer to this question. But the chemo is the same. So.
But
it's-
at least you gave me a tiny, a tiny bit of hope, because, you know, you said, we can treat it and maybe, you know, no guarantees or whatever, it might go away. He told me it's treatable, but it's not curable.
But I also want to be careful because I don't have a lot of some of the information he knows. So that's why I said I need
Yes.
to talk to him. But what I was saying, if the cancer are metastasized or like the cancer spot went to like limited spots in certain area, that's something sometime we can go after it
Yeah.
and remove it and we hope it doesn't come back.
But he never mentioned any other spots. Now, whether he didn't mention them to me, I don't know, but
So that would be a site reduction
So,
to where you just, what you see, you can take out.
exactly. That's correct.
yeah.
That's after you knock it with chemo.
Hmm?
That's after you knock it with chemo.
Usually we do that way because we not already like start to like travel, so you wanna try to get things under control with chemo, and then just like if you will like give us a test of time, and just give it time, see what how things looks like, and everything is stable, nothing appearing in chemo, and just few spots, couple of spots in the lining, I think that would be a good time to go after them.
Now, he did say that he took out 2 masses. I don't know if that's in his report, but
Well, it has to be.
yeah,
That one sounded pretty big,
yeah. He said there
like a
was
golf ball.
a good sized mass and a smaller one that he took out, but that I think he said that there was still some regimen of it being left. And again, you know, I'm not a surgeon, but why couldn't you get it all? You know what I'm saying? If you have someone open and it's right there in front of you, why would you not get it all?
Oh, he probably did. All that he could see.
No, that's not what he said.
Well,
It sounds like this is very important for you, that question. I can't answer on his
Yes.
behalf.
Yes.
For the obvious reason, but it might be worthwhile calling his office and say, hey, I want to talk with you, I have a couple questions, and just ask him that. Maybe his answers make sense and make you comfortable.
Yeah.
or next time she sees you, you have done talk to him.
I really want to just come here with you.
Yeah, you can come here, but as I said, like you asked me that question like 5-6 times, which I think it's like in your head.
Yeah.
And it sounds like it's bothering you. So
Yeah.
just to get some kind of like closure or feel comfortable, I think it's not a bad idea to hear from him what what is the reason? Because likely he has a good reason. He just
Yeah,
need to explain
sure.
to you.
Yeah,
So like once you hear that, might make you feel better.
yeah.
So let me then go ahead and ask one of our surgeons to meet with you. I really don't think they're gonna do anything urgent, but
Yeah.
maybe if something in the future. I think the chemo plan is appropriate, and as I say, FOLFOX is the right thing, which is like two drugs.
And I had asked him, and I said, so what is my life expectancy? Because, that's a question I think anybody would ask. And he said, I can't answer that. Because everybody,
You mean the surgeon or the oncologist?
the oncologist, he said, I can't answer that because everybody's different. Everybody, takes the chemo differently.
Some old ladies mean and they live longer.
But see, I'm not mean.
I don't think you mean. I think it's just like it's just overwhelming.
Yes.
It's like when you're feeling well and then things happen very quickly.
Yeah, like I never expected to go there and be admitted. I went there for what I thought was a stomach bug.
When did you have the surgery?
Yeah.
Okay, so you are about what, like almost getting close to 2 months, right?
Mm-hmm.
Like 6 weeks.
Yeah.
So likely you healed well.
Yep.
I think it's not a bad idea because I don't see you had a CT scan like in your abdomen after the surgery. The one I had,
Yes, I did.
like you had one in the chest. Do you have one?
Yeah, I had one in the chest.
Yeah.
Yes.
So I think it's a good idea to get a new scan of your abdomen.
Okay.
Just kind of like see how things looks
Yeah.
like. See if any spots that are there.
Okay.
Like contrast.
If you can set that up, I'll be happy to come here.
Yeah.
And your guy will put a thing on her right here.
Port. They talked about a port.
We need that. So the surgeon can do that too. They can do the port. And
Okay.
maybe when they do the port, they can also take a look there.
Okay.
So we need a scan, we need the port, and then we can start treatment. I will have my team talk to you more a little bit about like the chemo and more logistic. I know the team there, the guys there at home, they spoke with you about that, but.
And what can I expect from chemo?
So
Besides being sick.
Yeah, well, I don't think you will be very sick, but we'll have another visit for that.
Okay.
For like the teach and consent
Yes.
of that, because
Okay.
it just get too much in one visit.
Right.
So we'll do that, and if you wanna do the treatment here, that's fine. We'll have to take care of you.
Okay.
The only advice I would have, and just because I also want to be very candid, we'll do the same thing here as you're gonna do there. So it might be worthwhile saving the trip, like the commute.
But mentally, I feel better here.
Okay, it's up to you. Yeah. Because I was going to say, like, you can't do everything there, and every few months, if you need to come see me, like, just for advice, this has been going on, this is new, this happened, we can give you an advice, say, okay, let's do that, and I would be happy to talk to him. And just,
So would it be you giving the order of the chemo to them, or
no.
No, see,
No,
yeah,
so
I
you
wanna-
have to write.
I
You
wanna
have
be
to
here.
write everything there. Yeah.
Yeah, I want to
Yeah.
be here.
But I can work with on the plan with them.
Yeah.
But, yeah.
No, I really feel safer here.
Okay. All right. Any other questions?
Well, I pulled up a thing of questions to ask, but really it was my phone's going dead. Like tumor markers and
Well, actually, we'll do some blood work before we start anything, you have diabetes, is that right?
Yes,
Is it controlled?
with Victoza, yes.
So do you have any numbness or tingling in your hand?
They've been pretty good, because I read that sugar feeds cancer. I don't know how true that is, but I've been cutting back on a lot of sugar.
But you have no numbness or tingling in your fingers or
No tingling or nothing, no.
on your feet too?
No. No. And as far as the other goes, you know, I just read what you should eat and what you shouldn't eat, and I mean, does that matter now if I have stage 4? You know what
It's
I mean?
always good to eat healthy, because that will help with a lot of things. And if your sugar is not well controlled, that impact what we can do too. I will get the nutritionist to see
Yes, yes.
to speak with
So
you.
I like I said, I've just been watching myself, and it said sugar feeds cancer. So I try to stop
I'm not sure
sugar.
that's accurate, but like a lot of people believe so. So I think eating healthy is good.
Yeah,
I'm not sure for the cancer, but just for your body and your
why,
health.
yeah.
Right, guys. Any other questions?
I don't think so. I'd like to try to get everything going quick.
Yeah. I'm sure the team will do their best.
If you got a time machine,
If you got a time machine, yeah, send me back.
Can I see your one, please?
Yes, sure.
Sir, do you mind if I ask you why you're holding the phone like that?
oh, because I've got encephalopathy,
Yeah.
and we get home and we don't remember
Yeah.
anything that is said, so we're able to watch it on TV.
Okay, that's good.
Do you want me to?
Yeah,
That's fine.
yeah. See,
Yeah.
Uh,
No, so I just I noticed that, and like I just want to be also very candid. I would appreciate if you ask me if you can record me or video me before you do
Okay.
that without my consent.
oh,
I
what?
am not sure even if it's legal in North Carolina to record people.
Well, it's
without
really
your
just
knowledge.
for us.
I understand.
Yeah.
I understand. That's why I didn't say anything. I just
Yeah.
want to make the point. If you need that, please ask me if I'm okay with it.
Okay. Sure.
Which is fine, but yeah, because you don't want me to record you without like asking.